Welcome back to 41 Today Lifestyle, everyone. Today we're talking about endoscopic spine care with Dr. Kevin from Optim Neurosurgery. How are you, my friend?
I'm doing well. How are you?
Okay, well, that's a big terminology for me, endoscopic spine care.
You nailed it.
Did I?
Yeah.
I love that. All right, tell me, because you know the Aussie accent gets a little twisted.
A little bit.
Yeah, you've noticed that, have you? Tell me a little bit about endoscopic spine care. What is it? Dumb it down for everyone at home.
Sure.
And me.
Sure. So you think of traditional spine surgery as a big cut going up and down your back. So then minimally invasive spine surgery was developed, doing surgery through about 2-inch tubes. So this is the next level of minimally invasive spine surgery, where we take a 6mm camera through a little stab wound in the skin and go down and operate on the spine.
What conditions would you be needing to have that endoscope done?
Okay. Ruptured discs can be done through a 6mm incision. We are doing spinal fusions through the endoscope.
Can you explain to everyone what spinal fusion is?
If a person has a condition where the spine is moving too much or is incredibly painful, we take two vertebrae, two of the bones or more, and make them grow together.
Right. So is this more about we know we get these issues from maybe accidents or something like that,
Sure.
Okay? Or what about lifestyle and exercise to keep our bones healthy and things like that?
Absolutely. That's a great preventative measure to take.
Okay.
But everyone's going to get arthritis. If you live long enough, you will get arthritis.
Really?
Really.
What's the cause of arthritis?
Living life, wear and tear. For the most part, there are some diseases like rheumatoid arthritis, but most of us will develop what's called osteoarthritis, which is just wear and tear over time.
Okay, I got you.
And that's where endoscopic spine care, I think, really shines. So people have been told, you've got arthritis, you have to live with it, or you need to have a big spinal fusion. We can take the endoscope and actually get rid of arthritic back pain for about 4 years.
Really?
Right, and if and when it comes back in 4 years, we can repeat the procedure, and minimal downtime, no fusion, and it's just great for folks who are maybe over 50 and starting to get some arthritis.
Well, what are you doing when you're in there? Explain that part.
Okay.
Are you sucking something out? Are you putting something in?
So that procedure is called an endoscopic rhizotomy, and basically what we do is all the pain fibers that are in the joint that has arthritis in it send that pain pathway through a network of fibers. We go down, we identify these little microscopic fibers, and we actually cut across them.
Okay.
Sort of puts like a roadblock in the pain pathway.
Okay, are most people the right candidate for this type of procedure?
The nice thing about what the procedure I just talked about, the rhizotomy, is we do a test beforehand to see if a person's going to respond. So much like when we talked about the sacroiliac joint, we do the test injection with Novocaine. Yeah. We do the same thing here. And if a person gets pain relief, and about 80% of people do, then we know that that person will respond favorably to the procedure.
All right, with an endoscope, talk to me a little bit about the downtime. What do people expect? Take me through the process of that procedure.
Okay. So for endoscopic rhizotomy, it's an outpatient procedure. Yeah. It doesn't require general anesthesia. People need to take it easy that day because they receive sedation, so we don't want people running chainsaws. But the next day they can get back to work, their normal routine. We just tell people 10 days, no vigorous exercise or digging in the garden because the little stab wounds have to heal.
Okay, so you're basically up and about within 48 hours.
Oh yeah.
When do you know the results of the procedure?
That's actually a great question. It takes about 6 weeks to get the full effect.
So this isn't instant?
No, but it kind of gradually creeps up on people over 6 weeks, and the average length of time that it lasts is 4 years, and like I said, it can be repeated indefinitely.
I think it sounds fascinating. Where do you see the future of chronic back and joint pain going?
We're kind of getting into now joint replacement instead of fusion, which is definitely a big leap forward. I half jokingly say it to patients, but I really think it'll happen. Someday we'll just inject you with stem cells and we'll grow you a new disc if it ruptures. I mean, we're a ways away from that. But
not in our lifetime?
I'm not much of a prognostician, but
I'd like to think so.
Okay, I would like to see it during my lifetime, during my career.
Yeah.
It just really depends on the pace of the research, and it's clipping along, but at this point, I'm not ready to offer that treatment yet.
Yeah, I understand where you're coming from because I think it's always important to make sure we have the scientific results.
Correct.
All right.
Correct.
We appreciate you coming in again,
Sure.
Dr. Kevin. If you want to find out more information about Dr. Kevin, there it all is up on your screen now, Optim Neurosurgery. Back after this short break, everyone. You are watching 41 Today Lifestyle.